Thank you for having me. It's kind of great to be here. I hope none of you check out during this. I know when you hear risk management, people's eyes roll back in their head. And I hope I have some valuable information for you. No matter what we do in life, there's some form of risk. And each of our public entities have risk. You might think of it a little bit differently at the public entity level, but I mean, if you think, well, I could have no risk if I laid in bed all day. Well, if you laid in bed all day, eventually you'll get bed sores. Well, I don't have any risk getting out of bed. Well, you do if you trip. So there's risk everywhere we go. And our goal in risk management is to try to eliminate or minimize that or reduce, if sometimes it is our fault, how much we end up paying out. And we try to do that not only from a financial standpoint, but we look at risk in finances and in people, and then also in property. We don't want to injure our members of our community. We don't want to injure our employees. We don't want to be injured. Each of those have some financial impact, but nonetheless, we want to avoid that. From the standpoint of public entities, the most common risks we see or with relationship to claims end up being in the public works, law enforcement, and parks and recreation area. Those are just the numbers. We do have intermittent other claims that come through, but those are where the areas in an individual public entity where we see the greatest number of claims. When we look at claims from a type, they're usually in the casualty area. So bodily injury claims, property claims, some law enforcement use of force related claims, and land use. Just so you're kind of aware, those are the things that probably should be on your radar because they're the most common. Everybody has some sort of risk management structure, and what you'll see predominantly in Utah is some sort of self-insured retention, meaning that you have a fund from which you pay claims if there are claims or litigation, and then after that, there's usually some form of insurance, some reinsurance or excess insurance. There are a few entities that just fund their entire program. Those are generally the larger entities. Most everybody else has some form of a hybrid. There are also pools. If you're with the county indemnity pool or with our entity, the Utah Risk Management Agency, or if you're with another one of the pools, those pay into a self-insured retention. You contribute, but your funds remain there if you don't have a claim. That's the advantage of pooling, is that it's not like your regular premium in a policy where you pay the premium annually and then ultimately it's gone and you pay another premium the next year. The other thing is you share in some of the risk associated with that with other entities. One year, your entity may have a bad year and you pay out claims, and then you may not for several years, but you take advantage of the pooling concept. So I'd like to talk about a few concepts just so you know. Risk management services should provide all of the following to you. You should have some sort of risk identification, assessment, and analysis capability, whether that's your individual risk manager that does that for you, or risk management director, or the agency that does that for you, or entity. You should have some sort of education and training. And there are several Harvard and MIT studies that say this is the most effective way to reduce risk exposure. If people understand what the risks really are and what they really cost and how they really impact people's lives, as a general rule, they avoid them. And then you'll see claims and litigation management is another function of risk management. Insurance purchasing, and I mentioned that because it's a little bit different at the commercial level than it is in your private policy. Your private policy, you call your agent, they give you some recommendation on what the coverage level should be, and you pay a premium. Then if you have a claim, you call them. Well, it's similar, but commercial policies are quite a bit more complex, especially when it comes to the coverage. And then risk consulting. One of the things that you should be able to do as a leader is be able to reach out and say, tell me what the risks are associated with this, and have them do the research and be able to provide you good information about what those risks are. In the industry, there's a lot of talk about risk assessments. And I want to be careful to make sure, and I'm going to demonstrate in a couple of examples what the difference is. A risk assessment is just simply somebody saying, is this risky or isn't it? Now, you may look at this and it's kind of funny, but the reality is he's making a risk assessment, because what he doesn't know is, or he's not paying attention to, or not thinking about, is he can outrun the officer, probably. Can he outrun the radio? Probably not. Can he outrun the car if the officer gets back in the car and follows him? Probably not. And so what happens is we take a snapshot of things, and quite frequently we don't have good information. And good information is really critical when it comes to risk, especially for people like yourselves who are policymakers and decision makers. So, good news. How many of you have been the victim of the BMI? Raise your hand. Yeah, me too. Go to the doctor tells me what my BMI is, says you need to lose some weight, right? Want to know about anything about the BMI? It is fundamentally flawed from day one. It was an 1830s to 1850s experiment, which means, for those of you who can do the math really quick, it's 170 years old. We're still using it. It was adopted by the United States back in the 1980s, and it's taught in every medical school in the country. We still use it. So when you go to the doctor and he or she says to you, well, your BMI is this, and you should lose weight or gain weight or whatever that is, just know that there are a bunch of variables in the BMI, right? The only two factors, numerical factors or values that are taken into concept in the BMI are your height and your weight. To show you how flawed it is, here's my next example. Dwayne "The Rock" Johnson and I are the exact same height and weight. We both have the exact same BMI. We are both considered morbidly obese. How many of you would look at Dwayne's picture and think, yeah, he's morbidly obese? How many would look at, no, I don't want you to look at mine and say the same thing. Nonetheless, it's bad information. It is bad information. It is not statistically accurate. You can't extrapolate the data to the first standard deviation, which means it's less than 27% accurate based on the data set that was used. So when we take things like this and we go out there, unfortunately, we go from bad information to worse. We make decisions based on bad information. I've done an example of this. I did this at one of the conferences a year or two ago, where I had everybody in the room go through and say, okay, in your organization, I'd like you to list the top 5 risks that you have in your organization. And then we compared that data to what the statistics actually say. And for the most part, everybody got 1 or 2 of those risks. But the reality is, it varies depending on your entity. You can't just go across the board and say, well, every governmental entity has the same risks. Well, in general, that's true. But where they are priorities and which ones should be addressed in your entity should be based on data. So for instance, right now, cyber risk, for those of you who don't know, is huge. As a result of COVID, people started working from home, starting using a lot of their own equipment, or they used the entity's equipment, but your Wi-Fi isn't as protected as your local area network at the government building. And subsequently, claims for cyber risks skyrocketed. For any of you that are aware, your policies probably tripled or quadrupled in premium if you have a cyber risk policy as a result. So what that means is it could be an issue for your entity. Then again, it may not be. Maybe you have dual factor authentication for every single employee and they have to utilize it. Maybe there are extra safeguards in your information technology department that they've implemented that are very effective. So it may not be as high a priority in your organization as it would be in another's. That's why a risk assessment and that information is so important to ultimately get good information and not rely on just what everybody thinks. So the good news for all of you is, if you're worried about the BMI, I wouldn't be too worried about it because not mathematically correct. So that's what I said, hooray. And I actually had the actuaries look at it to make sure. So couple things that I want to talk about is, and if I can emphasize this the most, is being educated about what the risks really are. There is never, in the municipalities or with our organization, and last year I got about 300 different calls from members of the council or city management saying, tell us about this. What do you think the risks really are to the city? We're looking at doing this or that or another thing. We've had everything from they want to take over property that the Forest Service used to have and we'll deed it to the city, but it has a mine on it. And of course, the mine is frequented by people and it's kind of a historical tourist attraction, and which is great. The bad news is to try to ensure that there's what they call a minimum premium, and it's several $1 million a year just to ensure that mine. So the question becomes, you get this land for free and you want to continue to let people use it the way they've always used it. Is the government entity, is the city or the town willing to accept the risk of allowing it to be used that way? For those of you who don't know, it's difficult to sue the federal government. It's not as difficult to sue our local cities and towns. And so that's the kind of information that I think it's good to be educated on. We look at development agreements, we look at contracts, and look at those indemnification and insurance provisions. One of the things that we try to do in risk management is either separate or transfer risk. And how we do that is sometimes it's through insurance, right? So the insurance company is going to pay for that risk if something goes terribly wrong. Another one, and most commonly, is those agreements. And so with those agreements, it's important to understand and try to get the appropriate indemnification and insurance provisions. We review agreements for the municipalities that are in our organization. I can't speak for the other pooling organizations, and I don't know that process in everyone's city or town. But it's critical in transferring risks. If you have a one-sided indemnification agreement, it usually favors the individual that drafted the agreement. We always do both participating indemnification. We'll pay for our costs, you pay for yours. Another part of that is the insurance provisions. One of the things that I've discovered is that sometimes the people reviewing those agreements don't understand commercial liability insurance and don't really understand what the levels of coverage should be. So as you have development agreements or you have other agreements, you're constructing a building or whatever, I would encourage you to be educated about what the potential risks are associated with that development. The other thing is make sure that you get good information. You know, one of the worst things we can do as individuals, not just as community leaders, is to have bad information and act on that information. If you have a risk management entity that you're affiliated with, or you have your own risk management department, division, director of risk management, reach out to them. I've not discovered or seen anybody in the industry yet that isn't willing to offer insight or guidance or counsel. They're not willing. I've never seen anybody that's not willing to answer any questions. They're more than willing to answer questions. And I've not seen anybody that's not willing to look at research. And we do have access to quite a bit of research in the industry because we deal with the insurers. So you find frequently that something you think is a terrible risk because it happens a lot actually doesn't pay out a lot, or we don't have a lot of claims. With my former employer prior to this, I worked for a university system and managed risk for them. And until we did a study, we didn't realize everybody thought the risk was one certain activity and discovered that it was an activity they never ever thought of was what they paid out the greatest amount of claims on. And that's what we want to avoid doing. Those are funds that could be used for other things in the community, but unfortunately have to be dedicated to paying out claims unless we can reduce or mitigate the risk. So with that, we have just a couple minutes left, and I wanted to I could talk about risk all day long, but some of you probably don't want that. But are there any questions from anyone? I wanted to give anybody the opportunity.
I'm gonna ask water. It's been a big issue, obviously, in Michigan, but water shortages, but water cleanliness and water, how it's properly being used. I'm in Summit County, and they're starting to eliminate those individual septic tanks because it's seeping into the groundwater, which seeps into everything else that we use. So is water on that short list anywhere?
Okay, the question was about water and how it ultimately can be an impact either from contamination into the groundwater from septic tanks or otherwise. It is not on the short list because it's infrequent that we see a claim or litigation. I will say, though, with regard to contamination in the water area, the claims do pay out significantly. I would say that they're borderline on the high end as far as, so they're infrequent, but they are high in severity. One of the things that I will give you a heads up, you probably know this from watching TV, but social justice is a big issue now. We're starting to see more and more claims against our law enforcement agencies. And we're starting to see higher claims paid. In watching the insurance industry and talking to the actuaries, we're starting to see that at the municipal level, we're going to see huge insurance premiums if those claims and litigation keep creeping up. Juries are awarding higher awards than ever before. So that's on the radar. That's one of the big ones on the radar. The other thing we're starting to see is higher land use claims related to development agreements and zoning ordinances and construction. So, yes, ma'am.
You said you had a list of your highest issues. What are they?
I can tell you right now, collectively overall, the number one claim is bodily injury related. We get in traffic accidents or we injure someone somehow at a park or something else. So it's the highest frequency. Not always the highest paying out, but when you take the total number cumulatively and then add out how much we pay out in those, that number is big. Next to that, I would have to say is probably law enforcement claims. We pay out a lot in law enforcement claims. Like I said, some of that's just been in the last couple of years because of some of the social justice ideals out there and juries awarding higher claims. Then you're going to find it kind of levels off and it's a smattering of things from property to land use to contract disputes. Oh. Okay, I think I'm done, but thank you for your time. If I can be of any help, there's my contact information. It'll be up there for just a minute and I will turn it back over to, I think, John, you're next. Okay.